Dr. Hema, VK Hema, she'll be talking on the effect of oil versus gas on macula in retinal detachment, an OCT based study. Okay, please go ahead.
Good morning all. Intraocular TAMNate agents are used in complex retinal disease like diabetic and retinal detachments, etc. They provide a surface tension across retinal breaks and they prevent the fluid into the subretinal space until the retinopexy provide a permanent seal. The aim of the study is to evaluate the anatomic and function effect of siliconol and C3F8 on retina and also finding out the cause behind the unexplained visual loss in through OCT evaluation. This is a prospective study of 37 patients, 20 patients with gas and 17 with silicon oil. Two senior surgeons had done the surgery from Jan 2020 to May 2023 and the eyes were compared with the other normal eye of the patients. All patients who had diseases affecting macula and optic nerve were excluded other than RD and media obscuring diseases were excluded. Also, if the other eye or other normal comparing eye also had any macular optic diseases, they were excluded. Grade C PVR or more or use of perfluorocarbon were also excluded. And the findings noted were slit lamp examination, visual acuity, fundus evaluation, intraocular pressure. OCT was done at follow-up visit and statistical analysis was done with SPSS software. And 65% were males and their average age of presentation was 45 years. Mean duration of detachment was 8.6 plus or minus 8.2 and gas it was 8.6 plus or minus 8.1 and the evaluation was done before silicone oil removal. Mean intraocular pressure was normal and 66 patient had retinal degeneration in other eye. The BCVA mean was 0.73 plus or minus 0.35 logMAR and 36% patient had a 4-line improvement. Coming to the segmentation of the retinal layers, central macular thickness didn't have any comparable differences in both oil and gas filled eye when compared to the other normal eye. Coming to the layers and gas filled eye had thickening in RNFL, GCL and inner nuclear layer, but oil filled eye had no difference in any layer. There was no difference in inner plexiform and outer plexiform layers in gas filled eyes. Coming to the outer nuclear eye, there was a significant thinning in outer nuclear layer in both gas and oil filled eye when compared to the normal eye, and this was correlating with the visual decrease in visual acuity. There was no significant changes in RP and subfoveal choroid thickness, and inter-group analysis also showed no difference between gas and silicon oil filled eye. Coming to the discussion, the central macular thickness studies show thinning in central macular thickness, but our study showed no comparable differences. In retinal segmentation, previous studies has showed thickening in the inner retinal layers similar to our study, and also thinning of ONL was noted in many other studies similar to our studies. The inner retinal thickness compared to the other normal eye in a study can be explained by two mechanisms, then which is already explained in many studies. That is due to retinal edema caused by retinal detachment and also surgery-induced retinal edema. The outer nuclear thinning in both the groups is explained in different ways and also it is controversial, but we like to highlight some points regarding the effect of tamponade on the retina. The outer nuclear layer, the retina as a whole is affected by the mechanical effect of the tamponade, and the tamponade had some characteristic features like buoyancy, surface tension, and also the duration of the tamponade also affect the retina. But we have not studied the duration and correlated it with visual acuity, so we consider it as a limitation of our study. So when a tamponade is applied, the net force is equal to the buoyant force minus the weight of the bubble. Since the difference in the buoyant force and difference between the surface tension of the gas and aqueous is different, vastly different, but compared to aqueous and silicon it is only a small value. When we calculate this, the net force applied by the gas is more compared to the silicon oil on the retina. So this video shows the effect of bubble on the retinal layers, you can see that ONL is thinning. Why the inner retinal layers and RP or choroid is not affected should be further evaluated, and maybe due to the difference in the architecture. And also outer nuclear layer has blood supply from the choroid, and when compared to the other inner layers, and due to the edema there can be obscuration of the blood flow causing further thinning. So we conclude that the inner retinal thickening seen in our study can be due to the retinal edema as explained in previous studies. Thinning of outer nuclear layer can contribute to delayed and incomplete visual recovery. More studies need to be done for understanding the exact pathological process in this disease. And we also think that our study can target, put forward some light into targeting certain retinal layers for neuroprotection needed in the future.
I mean, as a like little bit new angle at which you are looking at, good only. You could have put some additional pictures to show example cases. That is one thing, and how you made the cuts, and what machine and how you made that cuts. That is, it would be a little bit more descriptive. Plus, the theory. One more confounding factor will be the duration of RD itself. So the longer the RD, you have some changes in the both the outer and inner. So that will be a confounding factor. Sometimes whether you had intentionally taken equal duration of RD in both the groups or a retrospective study, no?
Yes, sir. Actually, we have taken
Prospective, okay.
prospective, sir. We have taken only acute cases.
Acute case.
Like chronic RDs, we have excluded.
Okay.
And also, we wanted to. Yes, comparable, ma'am. 8.6 plus or minus 8.3.
And emulsification of oil wasn't considered. How long after the oil injection was it removed?
Mean period was 4 months. 4 months.
Was emulsification of silicone oil considered as far as your?
Yes, ma'am. Yes, sir. The cases with the silicone oil emulsification were not taken.
Not taken.
Because already it is explained the chemical
so
effect.
at 4 months, none of your patients silicone oil was not emulsified.
That's why we have a small number of cases.
Thank you.
Thank you, sir.